In this lecture, we will focus on a number of factors that can help break the Ebola virus disease chain of transmission, including proper use of personal protective equipment. Because Ebola virus is a biosafety level 4 biohazard, personal protective equipment is vitally important here. We'll look at infection control procedures, and we will see that while EVD is deadly, EBOV is relatively fragile. We'll look at isolation of symptomatic individuals and quarantine of contacts, and we'll examine the process of contact tracing to halt the dissemination of disease. So let's get started. Personal protective equipment, or PPE, is anything that is designed to maintain your health and well-being while engaged in a particular inherently hazardous activity. For example, steel-toed shoes and a hard hat are part of the PPE if you're working on a construction site. Now, if you care for anyone infected with Ebola virus disease, or if you handle contaminated fomites, you must utilize the appropriate PPE, and in the case of protective clothing, you must wear it correctly in order to avoid yourself contracting the disease. Now, the Centers for Disease Control and Prevention recommends that protective clothing leave no skin exposed. So with regard to Ebola virus disease, personal protective clothing must at the very minimum include gloves, protective mask, goggles or protective eyewear, and a gown, and we'll look briefly at each of these items. So protective gloves must be of a type to cover the hands well above the wrist. Protective gloves do not include latex or vinyl surgical gloves, which are much too thin to offer the wearer unquestionable protection. 2. Protective gloves must not be made of fabric or any other type of porous material. So, protective gloves then must be thick enough so as not to be easily torn or punctured. They must be impervious to moisture, thereby affording the wearer an effective barrier to blood and or other body fluids, and they must be unaffected by chemical agents used to clean and disinfect environmental surfaces as well as the gloves themselves. Protective gloves should be inspected prior to and following every use for punctures or tears, contamination, and degradation, which is indicated by maybe a color or a texture change. Gloves must be replaced if any of these things is noted. Gloves must be washed and air-dried after each use, and gloves must be sterilized after every use. Protective masks must be of a type to cover both nose and mouth in order to protect the wearer's respiratory passage. While Ebola virus is not an airborne pathogen, it is transmitted in blood, saliva, and vomit. So, effective protection of the mucous membrane of the nose and mouth is necessary to prevent potential contact with these substances. Approved surgical masks with an effective minimum filter size of 0.01 micrometers must be worn during EVD operation. Protective masks must be inspected prior to use for any manufacturing defects, and of course defective masks must be discarded. Masks become ineffective when moist or wet, so moist or wet masks should be immediately removed, discarded, and replaced. Protective masks are intended for only a single use. Masks must be properly discarded after each use. Protective eyewear. Now, protective eyewear is intended to provide the wearer an effective barrier from exposure to contaminated blood or other body fluids which may be easily absorbed through the vascular eyes. It is the vascularity of the eyes that makes them so vulnerable to contaminated fluids of any kind, by the way. Now, protective eyewear must completely isolate the eyes from the surrounding tissue, thereby protecting them from any inadvertent splashes of contaminated fluids. So a little note here, standard prescription eyewear and or over-the-counter reading glasses or sunglasses do not sufficiently protect the wearer's eyes from contaminated fluids. Like everything else, protective eyewear should be inspected prior to use for any sign of damage from a prior use. Eyewear, of course, must be replaced if any damage is noted. Eyewear must be washed and air-dried after each use, and eyewear must be sterilized after each use. Protective gowns. Now, protective gowns are intended to provide the wearer an effective barrier from exposure to contaminated blood or other body fluids, which may be readily splashed during care for or handling of victims of EVD or their bodies. Protective gowns must completely cover the wearer's clothing from at least to below the knees. To be effective, protective gowns must provide a seal around the wearer's neck. Also, the gown must have long sleeves that extend beyond the length of the protective gloves, with cuffs that provide effective seals at the wrists. Protective gowns must not be made of fabric. Rather, they must be made of a non-absorptive material in order to prevent the contamination of the wearer's undergarment. Again, gowns should be inspected prior to use. Gowns must be replaced if any damage is noted. Single-use gowns must be properly discarded after use. Multi-use gowns must be properly washed and dried after each use, and multi-use gowns must be sterilized after each use. Now, other recommended protective gear includes clear, impact-resistant face shields. Now, those further protect the eyes, nose, and mouth from fluid contamination. Rubber boots to protect the wearer's feet and shoes from contaminated fluids. Now, boots must cover the legs up to the knee, while the gown covers the legs below the knees in order to guarantee full protection. Even better, a full body suit or jumpsuit can be worn. Now, full body suits provide complete and unbroken protection from head to toe. Now, these suits must be fabricated from a moisture-impervious material, just like the gown discussed earlier. So, whenever possible and whenever budgets allow, all personal protective equipment should be disposable and thereby properly destroyed following use. Otherwise, appropriate disinfection and sterilization protocols must be adhered to. Infection control, as it relates to our discussion of Ebola virus disease, is the practical application of protocols designed to prevent the spread of disease or infection between family members in the same household, between members of the same community, or between those infected and their healthcare providers. So to begin here, people that have contracted Ebola virus disease must be isolated from everyone else. Now, more on isolation shortly, but all medical and patient waste must be properly disposed of. All medical equipment and any surfaces that may have come into contact with body fluids must be properly sterilized or disinfected. Now, during the 2014-2015 outbreak, special kits were distributed to help families treat Ebola disease in their homes, and these kits included protective clothing as well as chlorine powder and other cleaning supplies. Now, Ebola viruses can be deactivated by heating for 60 minutes at 140 degrees Fahrenheit or 60 degrees Celsius, or by boiling, that's 212 degrees Fahrenheit or 100 degrees Celsius for 5 minutes. Now, hard surfaces like countertops, bathroom fixtures, and bed frames, those kinds of things, must be disinfected with an acceptable alcohol-based solvent, a detergent effective at removing lipids, or sodium hypochlorite, that's bleach, or calcium hypochlorite, that's bleaching powder solution at appropriate concentrations. As we have seen in previous lectures, bushmeat is an important protein staple for many African populations. Bushmeat then should be handled and prepared with appropriate protective clothing and must be thoroughly cooked before consumption. As human outbreaks of Ebola virus disease often occur concurrently with animal outbreaks have been monitored to predict and prevent further EVD outbreaks in humans in those areas. And as has been previously noted, the bodies of those who succumb to EVD may remain infected for many days following death. Therefore, direct contact with infected bodies must be avoided. Bodies of Ebola virus disease victims must be handled only with appropriate protective clothing, as already discussed in this lecture, but unfortunately, many burial rituals in areas where EVD is prevalent requires the handling of the bodies of the dead. So, local education is necessary to break this important link in the chain of infection. Now, isolation is a process of physically separating a sick or infected individual from the healthy population in order to prevent the transmission of disease to the otherwise healthy individuals. Familiar you are, I'm sure, with the concept of isolation, as you were likely separated from your siblings or classmates when you were sick with the flu or any myriad of other common childhood illnesses like measles, mumps, conjunctivitis. By contrast, quarantine is the process of physically separating individuals who might have been exposed to disease from the general populace until one of two things happen. Either that individual develops symptoms, in which case they are immediately placed into isolation, or the disease incubation period passes and the individual remains asymptomatic, in which case the individual is free to return to the general populace. So this animation will put the concepts of isolation and quarantine into perspective for you. So this is your family, and this is you. Now, you become infected with Ebola virus disease. At this point, you are symptomatic. Although no one else in your family is showing symptoms of infection, they have certainly all been potentially exposed. Now, because you are symptomatic, you are placed in isolation and subsequently treated. And because your family members have been exposed, they are placed in quarantine for the designated 21 days. Contact tracing is an important step in containing outbreaks. Contact tracing involves the identification and diagnosis of everyone who may have come into contact with an infected individual. With sexually transmitted diseases, contact tracing would of course involve identification of sexual partners or those with which the infected individual has had intimate contact. In the case of Ebola virus disease, contact tracing involves identification of those with which the infected individual has had even casual contact. Ebola virus disease contacts must be watched for signs of disease for the requisite 21 days. Remember that 21 days is the incubation period for EVD. Now, if any of these contacts becomes symptomatic, they must be isolated, tested, and treated. And then the process is repeated by tracing the contact's contacts. So let's use this little graphic to illustrate contact tracing. So you have Ebola virus disease. You are then placed in isolation, as we discussed before. Your family, having been potentially exposed, is placed into quarantine. That's priority number 1. Your friends and healthcare providers or co-workers or classmates are priority number 2. Your indirect contacts, that is, friends of your family members, are priority number 3. Now, if any one of those begins to show symptoms, then their contacts become priority number 1, and the cycle starts over again. So you can see, I hope, how critical contact tracing can be towards the containment of epidemics or pandemics like Ebola virus disease, as the consequences of a single individual's contracting of EVD can be quite extensive and far-reaching. Okay, so you have done everything in the book to protect yourself from contracting Ebola virus disease. However, what if, through some unfortunate turn of events, you end up infected? What then? Is Ebola virus disease an automatic death sentence to those who have it? In the next lecture, we will answer that question and examine the protocols for treating victims of Ebola virus disease. See you shortly.